everyone, and welcome back to the series 5 in 5, where I provide you with 5 clinical tips in 5 minutes or thereabouts. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. As always, if you haven't subscribed, then make sure you hit that subscribe button and give the video a thumbs up if you enjoyed it. So let's get started. This video is going to be about pain, how you can take a good pain history. Taking a pain history is so important because pain is subjective, and it's really important for us to get a really clear understanding of what this person is experiencing so that we can help them to the best of our ability. You may know already a tool that I'm going to mention, or a mnemonic called SOCRATES. This is a really good tool because it covers a lot of things about pain, which helps us manage the patient effectively. So SOCRATES stands for site, that's where the pain is. Onset, when did it start? Character, what type of pain is it? Is it a crushing pain? Is it a dull, stabbing, shooting, sharp pain? Radiation, does the pain go anywhere? If it's back pain, does it go into their legs, for example? Any associated symptoms, so that could be if it's chest pain, do they have any sweating associated with their chest pain? Any nausea, any vomiting? T is for timing and duration. So when did the pain start? How long does it last for? Has it changed over time, and if so, how? Exacerbating and alleviating factors. What makes the pain worse? Is it movement? What makes it better? Is it analgesia? Again, could it be movement making the pain better? Or is it rest making the pain better? The last S is for severity. Again, this is such a good tool. You must always ask about severity because it really helps us understand if maybe a pain medication is working or not, and by how much if it is working. So usually I will say to patients, on a scale of 1 to 10 or 0 to 10, with 1 or 0 being no pain and 10 being the worst pain that you've experienced, how would you rate that pain? And you can also ask them, when they've taken an analgesic medication or a pain reliever, has that pain score changed in any way? So my second tip here would be knowing about the different types of pain, because again, that can help us with pain medication. So for example, neuropathic pain, that might respond to a neuropathic agent like amitriptyline or pregabalin. Tip number 3, ask specifically what they have tried. Some people haven't tried anything. Some people have. If they have tried something like ibuprofen for pain, they may not have taken it to the best dose or the optimal dose that may help them with their pain. So it's always good to ask them how many tablets have they taken and the dose if possible, because not everyone knows the dose that they're taking or how many tablets would equate to a certain dose. So it's always good if you can to find out a specific amount of information about the dose. And like I said, some people haven't tried anything because they're worried about masking symptoms. Tip number 4 is to know about the WHO analgesic ladder. This again is a really good tool. And just remember, when you go up in a stepwise fashion, you can use more than one medication to manage the patient's pain. My final tip is asking other questions. So just food for thought, things to consider would be, have they had this pain before? Is it an acute pain or is it chronic pain? And this is important because you would manage them maybe in slightly different ways. Ask about mental health. Having pain, being in pain is not nice for anyone. I'm sure if you experience something yourself, you don't like to be in pain, and so your patient wouldn't want to be either. If it's long-standing pain, or even if it's an acute pain, this may affect their mental health. This may make them feel depressed. This may make them feel anxious. This may limit what they're able to do, and in turn make them have a low mood. So asking about mental health is really important when it comes to taking a pain history. So those are just a few tips to get you started with a pain history. If you found the video useful, then as always, make sure you give it a thumbs up and subscribe if you haven't already. I will see you in my next video.